As you've heard from Alan, so much is better. So much is better in the world, but there is still a lot to do. And in my world, the group who shouldn't be dying, pregnant women and their babies, still need an enormous focus. I'm a midwife. I've worked for 30 years in this capacity in Australia and other countries including Malawi, Papua New Guinea, Cambodia and across the Pacific. I've seen firsthand the joy of birth, but also the sorrow. Most of the time, midwifery is very bright and happy, but when a mother or a baby dies, it is black and heavy with sorrow and silence. Today, in the 1 hour that we will give these talks, 34 women will die in childbirth, equating to 300,000 deaths a year. That's the same as 600 A380 jumbo jets going down each year, more than one a day. Imagine what our governments and the media would do if 2 large planes crashed every day or so. The tragedy is that 99% of these deaths in childbirth occur in low to middle income countries, and almost all are preventable. The other tragedy is that most of these women, or many of these women, didn't want to be pregnant in the first place. But it's better than it was. 25 years ago, 500,000 women died each year, so there have been significant improvements, with 200,000 less deaths. That's 200,000 families who get to keep their mothers. For every woman who dies of pregnancy and childbirth-related complications, another 20 experience a form of morbidity or disability that may have long-term consequences on their health, well-being, and even their social and emotional status. Simply surviving childbirth is not enough. We must make sure every woman thrives. The other critical group, of course, are the babies. Each year there are around 2.6 million stillbirths and 2.5 million babies who die in the first month of life. That's another 600 babies dying in the hour that we talk today. That's many less than 20 years ago, as great progress has been made, but it's still too many. The loss of a baby causes heartbreak for all. It's a lost opportunity. It's a loss for the mother, the family, the community, and the country. Who would know what those babies might have grown up to be in their countries? That's also around 5 million women and families who are sad. And in many countries around the world, babies who have died are not acknowledged, not named, and not allowed to be remembered or grieved. Even in our own country, we're not very good at acknowledging these losses, especially for babies who are born still. Last week, though, we had for the first time the loss of stillbirth recognised in our own federal parliament with the release of the Senate inquiry into stillbirth and a breaking open of the silence that surrounds this sadness. So there is still much to do. Things have got better, but there are huge opportunities to contribute to improvements. I always feel it's not right that being pregnant and having a baby in Australia is safe for the most part, but 1 hour north or 3 hours east or west of our shores, it is not. We are doing great things here, but we want to do more, and we can. In the last decade, we've seen an explosion of interest and commitment to women and girls on the global stage. Gender equity and gender equality are now talked about in big forums like the United Nations and the World Health Organization. Investing in girls and women is known to be good for the economic development of all countries. It's not just a good thing to do, it's the only thing to do. Australia has contributed significantly to improving maternal and newborn health in our region. One of the key strategies we know from a lot of research is that good care during pregnancy, the birth, and afterwards makes a difference, especially access to a midwife in every country. I've been involved in the redevelopment of midwifery education in Papua New Guinea, working with the National Department of Health and 5 midwifery schools to rebuild midwifery. PNG has one of the highest rates of maternal deaths in the world. It is estimated to be around 700 per 100,000. As a contrast, in Australia the number is 8. Having educated midwives in every health post and every health centre is key to turning this around. With funding from Australian aid, there are now 900 midwives in Papua New Guinea, more than twice as many as they had 5 years ago. Not enough, but heading in the right direction. We are now part of analysis of the whole reproductive, maternal, newborn, child and adolescent health workforce across the 16 countries of the Pacific, including Papua New Guinea. This work is led by the United Nations Population Fund, and the findings will help governments and donors like the Australian government to better plan how to help countries have enough midwives, doctors and nurses to provide care. There are many things that cause women to have poor outcomes due to pregnancy and childbirth, and malaria is one of them. Australian researchers have contributed significantly to the understanding of malaria in our region. Malaria is very common in countries like Papua New Guinea and responsible for many problems in mothers and babies. Malaria makes pregnant women anemic, where they don't have enough red blood cells, and this makes giving birth a real risk to their lives. Malaria also leads to more miscarriages, stillbirths, babies who are born too early, too small, or both. Our team at the Burnet is doing groundbreaking research to determine new, quick, and effective ways of diagnosing malaria, especially in rural settings where there's no access to fancy machines. We're also researching immunity to malaria in pregnancy and trying to work out why some women are more or less affected than others. This work and other studies being done here in Victoria are all contributing to developing a vaccine for malaria, which could save millions of lives. Another critical area to improving maternal and newborn health is access to modern contraceptives. Around the world, less than half the women who want contraception cannot get access to it. That means they have little choice on when to have a baby, have them too close together, and being pregnant more often puts them at risk of dying in childbirth. In the area that we're working in Papua New Guinea, only 20% of women have access to the contraceptives they want. We need to work out better how to improve access to services through education, research, training of health workers, and the support of local community leaders and churches. Different things will be effective in different places, but understanding how improvements can be made is necessary. Victorians are leading research and development work to change the lives of mothers and children around the world. These include having a quick diagnosis and treating sexually transmitted infections in Papua New Guinea, having better post-abortion care in countries like Myanmar, providing education to adolescents in schools in Myanmar, working out ways to improve nutrition in underweight babies in PNG, Timor-Leste and Laos, and improving immunisation rates for children in Myanmar and Papua New Guinea. Researchers are also seeing if infections in newborn babies can be reduced by using chlorhexidine, which is an antiseptic, on their umbilical cords in Papua New Guinea, and finding out if infections in newborns can be more quickly diagnosed using a new test that can be done at the bedside. Researchers in the state are also examining the involvement of fathers in countries like Zimbabwe and Kenya, addressing challenges around menstruation for women in Pacific Island countries, working out how to strengthen fragile health systems, and so much more. And Sharon will soon talk about the important work in HIV that is also having a big impact on mothers and babies. Finally, to highlight one of our other flagship studies, which is addressing the acute need for more knowledge to make change happen. This study is called Healthy Mothers, Healthy Babies and being done in the East New Britain province of Papua New Guinea. The study has recruited 700 women when they were pregnant and followed them and their babies for a year. Many of these women live in really remote communities and tracking them down has been an enormous challenge. The study has now completed all the follow-up visits, more than 2,290 maternal health visits and 1,500 baby checks, mostly done in really isolated villages across East New Britain. We're now analysing the data and the findings will help us, with our colleagues in Papua New Guinea, work out exactly what needs to be done to make a difference to these mothers and babies in the future. Some of you might be thinking, why do we need all this research? Why don't we go out and just do what we know works? That's a very good question and a challenge for us all as well. The temptation is to rush out and implement what we know works here in Australia or in some other country. The need is so great, you might say, let's just go and do something. However, in my experience, that approach is likely to fail. Research is essential to working out exactly what to do in different countries and in different contexts. Without quality research, we'll easily go off and implement the wrong things, waste money, and perhaps even cause harm. Research and development takes time. It involves walking alongside and behind our colleagues in the countries in which we work, making sure they also develop the skills and capacity to do this work, and will be able to do it by themselves in the future and train others in their own countries. It takes time to work out the right questions, consult with the right communities, engage with governments and health departments, and bring everyone along. I'd like to end by paying tribute to the amazing work done by Victorians in the global health space. Too many to name, but each and every one is making an impact, and many of you are here in this beautiful room this afternoon. Finally, every pregnant woman in the world deserves quality care. You would want this for yourselves, for your partners, for your daughters, and for your granddaughters. We all want the best care, the best outcomes, thriving babies, and healthy, beautiful mothers. We all want the same for the women of the world, especially the most vulnerable, the most hard to reach, and the most far from care. Thank you.